Hi, I'm Dr. Maggie Landis, and I'm the Director of Perinatal Services here at Seton Medical Center in Harker Heights. Today we're going to have a short educational video about how to set up the Neopuff in the delivery room for resuscitation of a newborn and how to initiate positive pressure ventilation in the delivery room. First thing is we want to talk about how to prepare the delivery room for a resuscitation. The Neopuff must be in the room and must be hooked up properly. The first couple of minutes after delivery, if the baby is not able to initiate spontaneous respirations on their own, this is going to be what secures a good outcome for that infant. So the first thing is to connect the Neopuff to your wall gas source. This is pretty self-explanatory. But air goes to air with the yellow hose and oxygen goes to the green. You'll hear a hissing noise and then you need to keep tightening it. Some of the rooms tend to make a whistling noise. This one doesn't in here. This one just makes a hissing noise like that. Keep tightening it. It's not all the way tight. The hissing stops, you know that you're connected properly to the gas source. First thing you want to do is turn on the flow of gas. So here you're going to turn this up to 10 liters per minute. And that doesn't have to be exactly perfect, but that's the recommended amount to generate flow through the circuit so that you can deliver pressure to the infant. Once you have set that up, you do not need to change that for all of the resuscitation. So you just set that at 10, leave it alone. The next thing you want to do is set your blender. So this tells you how much percentage of oxygen, or FiO2 as we say, is being delivered to the baby. So 21% is all over here on the left. That's room air, and that's where you start resuscitations with full-term infants. If it's not already there, you're going to turn that needle all the way over to the left for 21%. The next thing is you want to make sure that this corrugated tubing is attached properly. A common mistake is that this gets discarded after a delivery and then not replaced. So the machine may be in the closet like this. That's a problem, and you won't be able to do positive pressure ventilation on a baby without that tubing. So there's extra tubing in these bags. There's also extra tubing in the nursery and the respiratory closet. So this needs to be attached properly. The next thing you want to do is you're going to check the pressure that the Neopuff is set for. This little blue cap tells me that this is a new circuit and has not already been used on another infant. So we're going to take the blue cap off to test it and then replace it. That way, if you end up not using this in a resuscitation, this doesn't need to be wasted supply. The manometer here is telling you how much pressure is going to be delivered to the baby. You want to have the peak inspiratory pressure, or the breath pressure, to be 20 for a full-term baby. And the PEEP, or the constant low level of end expiratory pressure, to be about 5. When we say CPAP, that's essentially the same thing as the PEEP, or the positive end expiratory pressure. So the best way to test this is you're going to put the open end over your hand here. So what you're seeing on the manometer now is the PEEP, and we want that to be about 5 for a full-term baby. This white dial here is what you're going to adjust to make that go down or up, okay? Now, if you have it much below 5, that's not enough pressure to inflate the baby's lungs, and essentially you're not helping at all. If it's too much above 5, then there's a much higher risk of pneumothorax or other complications. So you want that to be right about 5. Now, the way you're going to test the PIP, or the breath pressure, is by occluding that hole on the front. So when you see that, the needle goes up to about 20. Now, the way you adjust that number is by keeping the hole occluded, and then the blue dial here makes that go up and down, as you can see. So we want that to be at 20 to start our resuscitation. Now, you always have to recheck the PEEP after you've done the PIP, because sometimes it changes, okay, if you've inadvertently moved the dial or anything. So we want to check that it's 20 over 5, 20 over 5. That should be set up for your resuscitation now. Now we're going to review how to deliver positive pressure ventilation to a newborn in the delivery room. And I cannot emphasize enough what an important skill this is for the nurses and the respiratory therapists that are going to be in attendance. We are at a facility where the neonatal provider may or may not be available immediately, and the respiratory care that's delivered to the baby in the first few minutes of life is going to ensure a good outcome for everybody. The statistics do show that 1 out of 10 normal, low-risk, full-term deliveries do require some resuscitation for initiation of spontaneous respiration. So that's where you come in. That may mean several times a week we're doing this to an infant here at Seton, and so everybody on the staff needs to know how to do this. I find in my experience that with the NRP algorithm, people tend to be overwhelmed by the dosage of medications and the chest compressions and all the other advanced cardiac resuscitation. And while that's an important skill also to have, that is going to be used far, far less frequently than good ventilation in the first 5 minutes of life. So that's what we're going to review here. So now that we've talked about how to set up your equipment properly, we're going to briefly review initiating positive pressure ventilation on an infant in the delivery room. The first thing is you need to make sure you have the right size mask. These are in a supply bag on the Neopuff. Large is going to be far and away the most common size used and should fit most term newborns. So you're going to take the blue cap off, put the mask right there. Now, common mistakes that I see when putting a mask on a newborn baby, first of all, is that the mask doesn't fit properly. If you have any air leak under the chin or up around the nose or eyes, there will be no pressure generated in this circuit, and you will not be delivering any effective ventilation to the baby. Likewise, if it's too small of a mask and it doesn't cover their complete nose and mouth, then the same problem occurs. So you want to make sure you have the right size mask first of all. When you place the mask on the baby's face, you want to make sure that you're not occluding their airway. Newborns have very large heads and very anterior airways. So if their chin is tucked down with their big giant head, you're not going to be able to get air into their lungs. By the same token, if you've hyperextended their neck way far back like this, then they're going to be occluding their airway anteriorly, neither of which are effective ways to ventilate a newborn. The proper way is to have a slightly extended head, considered the sniffing position, and you're going to apply your mask there. Now you can see on our manometer here, we already had it set up. If you hold the mask and there's a good seal, you should be seeing the pressure that you have set as your PEEP. And we sort of use the word CPAP and PEEP interchangeably in the delivery room. But we've set that to 5, and you can see here it's reading 5. Now when you start initiating ventilations, you're going to cover, I'm just going to turn this here, cover the hole, and that should be giving you your peak pressure, which we set as 20. Okay? If the needle doesn't move up, then you're not giving ventilation into the baby, and there's either a malfunction with your equipment, their airways occluded, or another problem that you need to troubleshoot before moving on. Now, the couple of common problems I see is, first of all, delivering the breaths too fast, because the tendency in a resuscitation is to be a little bit anxious and to sort of lose track of the speed that you're ventilating the baby. Doing like this is not effective whatsoever and is not going to help the baby. The best way, and I believe this is how they teach you in NRP, is to think of it like a waltz. So you're going to breathe, 2, 3. You're not breathing on the 2 and 3. So breathe, 2, 3. Breathe, 2, 3. The baby should be getting somewhere between 30 and 40 breaths a minute, and that is it. That's all they need to help them get rid of the carbon dioxide, which is the main problem why they're not breathing in the first place. The other common mistake I see is that you're not delivering an adequate breath because you're not holding, occluding the hole for an appropriate amount of time. So just tapping on that, and you can see the manometer, that doesn't do anything. That is not enough pressure to get into the baby's lungs, because it has to come through the machine, through all the tubing, through the mask, into the airway, into the lungs. And just tapping on that is not enough. So that's like blowing in the baby's face. That's not effectively ventilating. So you need to be occluding the hole for about half to 1 second. And so using the waltz cadence will sort of help you do that if you're doing breathe, 2, 3. Breathe, 2, 3. And that's enough time that the baby is getting the oxygen and then being able to exhale the carbon dioxide. Really quickly, we'll review. You hook up the gas to your wall source. You're setting your flow at 10 liters per minute and leaving that alone. The blender is going to start at 21%, and this is something I didn't mention earlier, but this will change through the resuscitation. So you need to listen to the person who's directing the resuscitation. And if the baby does not respond to a short period of positive pressure ventilation at 21%, we're going to pretty quickly be increasing this. So when they say, I need that turned up to 40 or I need that turned up to 100%, that's what we're talking about right here is the blender. You've got your corrugated tubing, you've got your proper sized mask, and then you're going to have your PEEP set at 5 and your PIP set at 20. And if you have all those things done, you should be able to assure a good outcome for the baby. The first couple of minutes are critical, and this will help you do it the right way.